I'm Laura. I'm a consultant cardiologist, and I would like to tell you about John. John is 66 years old with a history of pre-diabetes, gout and obesity. A couple of years ago, John attended an NHS lung health check screening in Manchester. Although he quit a few years ago, John had smoked from the age of 15 until 49. He had a CT scan of his chest as part of a lung health check. This didn't show any evidence of lung disease or lung cancer, but did report evidence of calcification of his coronary arteries. John's report was sent on to the local cardiology department, who suggested that he start on statin tablets to reduce his cholesterol, regardless of whether his cholesterol was raised or not, as evidence of coronary artery calcification on a CT scan is a clear indication of coronary artery disease or fatty plaques within the heart arteries. John's GP prescribed a small 20 mg dose of atorvastatin. John had heard from his friends that statins were risky tablets to take, so he tried to find out more about them before starting to take the tablets. He Googled statin side effects and was presented with a long list of side effects, including muscle aches, weakness, cramps, and a condition where the muscles break down. He also found out that they can cause lots of other side effects, including gastrointestinal symptoms, headaches, dizziness, fatigue, and sexual dysfunction, amongst a list of 24 other side effects generated. Understandably concerned, John decided to head to YouTube to find out more. He searched, "Are statins bad for you?" and watched videos and news clips which warned against taking them. Increasingly worried about the advice given by his GP, John joined a Facebook group entitled Statins, the Silent Killer, and was horrified to read the stories of other people online seriously harmed by statin use. After reading these posts, he had another chat with his GP. John's GP reassured him that the stories he'd seen on Facebook and YouTube were very rare and directed him to the NHS and British Heart Foundation for further information. His doctor also explained that he was at a higher risk of a heart attack than usual, as his CT scan had demonstrated that he had lots of fatty plaques in the heart. And in this case, people have been proven to have coronary artery disease. Furthermore, he explained that there were studies showing that patients given placebo sugar tablets thinking they were statins experienced the exact same number of side effects as those taking statins. His GP also used an online calculator which suggested his heart age was 88, with a 21% risk of a heart attack or stroke within the next 20 years. John now felt conflicted, worried about his risk of heart attack, but equally concerned about the horror stories he'd seen on the Facebook groups. He consulted his son, who, in turn, looked to TikTok and Instagram. From these social media platforms, they learned that John could get an equal reduction on his heart attack risk by taking cod liver oil daily. John decided on this course of action. 2 years later, John was admitted to hospital with chest pain and had a heart attack requiring a bypass operation. Following the operation, the cardiac rehabilitation nurse once again discussed the importance of statins. John was now happy to start taking these pills. John's story is not unusual. Online misinformation about heart medication is sadly all too common. Health misinformation can lead to the rejection of scientifically substantiated treatments and the use of potentially harmful alternatives. That's why ensuring we're all in command of the facts and evidence is so important. Full Fact is a fact-checking charity. They don't work for health practitioners or pharmaceutical companies, and none of their funders have a say in how or what they choose to check. Their mission is simple and essential: to help people like John identify false health claims by producing evidence-based facts, and to improve the quality of public health information. Thankfully, John has made a full recovery now from his heart attack and is back to his usual activities, happily taking all his medications without any side effects. He would, however, have saved himself a good deal of pain and anxiety if he had been able to dismiss the misinformation he'd read more quickly and started his statins without delay.